I'm very thankful to the Society of Vascular and Interventional Neurology to invite me to talk on the Mission Thrombectomy and World Stroke Day. So there are a lot of challenges in Pakistan. I will show you how can we deal these challenges. So as you know, stroke is number one cause of morbidity worldwide and number two cause of mortality. And in 2015, this treatment is mechanical thrombectomy. Mechanical thrombectomy is a standard care of treatment for large vessels occlusion. So if you see the population of Pakistan, Pakistan is number 5th in the world population. Estimated population of Pakistan is 255 million with a median age of 22.5 years. The estimated annual incidence of stroke in Pakistan is 250 per 100,000. It is a very large number of patients. And every day, approximately 1,000 people suffer from stroke in Pakistan and 400 patients die of stroke. I'm pretty sure these are only registered cases. In Pakistan, there's a very poor registry. So must be there more than 1,000 patients per day of stroke. Unfortunately, in Pakistan, every third patient is hypertensive above the age of 45. And 20% of the patients below the age of 45 is hypertensive. So hypertension, as you know, is the leading cause of stroke. So we are dealing a lot of patients with strokes day by day. As you know, second most common cause of morbidity and mortality, number one cause. Number two cause of mortality, number one cause of morbidity. So there's no formal stroke intervention program. Why there's a need to start this stroke intervention program? As you know, in Pakistan, there's no formal stroke intervention program before 2021. If you see, population of Pakistan is 255 million and 55 million in province of Sindh, where we are living as of 2024. As a total, there are almost 300 neurologists in Pakistan. And unfortunately, there are only 4 neurologists in Pakistan is neurointervention trained. And if you see the number of radiologists, interventional radiologists, I'm talking about the interventional radiologists, is 110 interventional radiologists in Pakistan. And this is my field, so I know not more than 10 radiologists is intervention trained. And if you're talking about the interventional cardiologists, there are 400 in Pakistan. So I don't think there's a good way to deal or overcome this deadly disease. The only way is to train the interventional cardiologists. So there are a lot of challenges in terms of training centers, burden of stroke cases, procedure costs. As you know, in Pakistan, 90% of patients have no health coverage and has to pay the procedure cost with their own pocket. And if you consider the mechanical thrombectomy, the total cost of mechanical thrombectomy procedure cost is around 5,000 to 6,000 US dollar. The only long-term solution, in my point of view, is to expand these services as public-private partnership. So best possible solution to start this service in public sector, because I already struggled 2 years to start this mechanical stroke services, intervention services in private sector, but failed to start it because patients have no money. If you ask about the money, it's very difficult to start this 4 hours or 6 hours window time, the mechanical thrombectomy. So the best possible solution to start these services in public sector with government funding to get benefit of maximum number of patients. Initially, we were struggling due to poor funding from the government sector. But fortunately, with the help of our foreign faculty and Dr. Fadl Dedi, they provide the supplies and without any delay, and we will continue this project. As you see in the picture, on the left side, there's a map of Sindh province. If you see on the top, this area is far away from the Karachi, and this is a lower Sindh area, and we are sitting here in the Karachi. So we started first center in Karachi, and these on the right side, there are 9 satellite hospitals of Karachi. Sindh. 9 satellite hospitals of Sindh. They are fully equipped cardiology hospitals. And in the center of the bottom row, this is chest pain unit. We call it CPU. CPU is 28 in numbers in Sindh province. And this CPU is equipped with defibrillator, ECG monitoring, emergency medicines, and paramedical staff and doctors. If any patient unable to reach the satellite hospital, and if can reach in this chest pain unit, we can drip and shift this patient to the nearest satellite hospital. So if you consider overall in Sindh, we have 9 full-fledged hospitals and 28 chest pain units. So if you consider all these, we are the largest cardiac network. So this is the best place to start a stroke intervention service to get benefit for the maximum number of patients. Luckily, in 2021, maybe, I talked to Fazal Zaidi, as Fazal Zaidi said, and he started helping me out to start this service. I'm very thankful to Fazal Zaidi, Hisham, and other guys. So in 2021 September, luckily this procedure performed, and after performing this successful procedure, and the name of this patient was Sufia. I always remember this name because the catheter was also used as a Sufia. So this patient was completely knocked down and unable to speak and loss of powers. And after 4th day, she was walking, and 6th day we discharged this patient. So journey start with NICVD Karachi. So far in NICVD Karachi, we done 350 intervention mechanical thrombectomy procedures successfully. And after Karachi, we start the next center. Second center is Tandu Ahmad Khan. Tandu Ahmad Khan is almost 3 hours, 2.5 hour drive from the Karachi. Because when we start this treatment in Karachi, there are a lot of patients coming from other parts of the Sindh. And unfortunately, they reach after 8 hours, 7 hours, 9 hours, 10 hours, because Sindh is a big province, and Upper Sindh is almost 9 hours from the Karachi by road. So then we started stroke intervention services in Tandu Ahmad Khan in January 2024. And we performed so far 80 stroke intervention procedure. And then for covering the Upper Sindh area, which is 8 hours away from the Karachi by road. So 52 procedures were done successfully in Sakkar. So if you calculate, we are performing mechanical thrombectomy services free of cost with the support of the government and foreign faculties. And we are almost covering the whole Sindh area. If any patient want to reach in these 3 centers within 4 hours, they can reach. The problem is awareness. So if you see the achievements so far in the NICVD, we signed a memorandum of understanding with University of Toledo. We are in continuous learning process with this university, and Dr. Fazal Zaidi team is helping out. His team is in WhatsApp group all the time. He is helping us. And soon we will start a monthly Zoom meeting with stroke intervention team of Toledo and NICVD Karachi. This is an international faculty, Fazal Zaidi, and he is working in University of Toledo as a professor of neurology and interventionist. Dr. Hisham Salauddin is working as an intervention neurologist in Antelope Valley Hospital, California. We continue performing awareness session, training session for the ambulance service 1122 of Sindh services. These are the pictures, few pictures of the trainings of the ambulance staff. And awareness, as I already said, very lack of awareness in Pakistan, even in doctors community, because they can't reach in the hospital after having a stroke in 4 hours. So we are in the process of continuously performing awareness session, and in November there are 2 sessions already planned in different places. So the problem is that when we start train a cardiologist for neurointervention, stroke treatment, many neurologists, many radiologists, and many surgeons, neurosurgeons are against us. So out of 14 cardiologists, our 10 cardiologists board certified from European Diploma in Stroke Intervention, and 4 are appearing in this coming exam. They also certified from NIH stroke scale. So for the awareness and training of the nurses, our nurses are got Angel certification. We have a 164 slice Toshiba CT scanner in our NICUD premises, and Tandu Mohammad Khan and Sakkar. And we also have 2 MRIs. One is portable hyperfine MRI, and other one is 1.5 Tesla supercon MRI. As Zeddy says, we have a rapid AI system. This is first system in Pakistan, thanks to the University of Toledo, Dr. Zeddy and ProMedica. We already successfully completed supernova trial. Nowadays, we are engaged in neutron trial, which is a distal access catheter trial. Soon we will start QVEST trial for the ICAT patients. And after that, planning to participate in the stem cell therapy for the stroke patients. So what are the future project? The gray structure is next to an ICVD Karachi, is already ready for the for a couple of months to start the services. This is a dedicated 7th floor pediatric cardiology unit, which is 300 bedded hospital with 5 operation theater, cath labs, 1 hybrid lab, CT, MR, and all these things. And our next project is on 40 acres, 1,200 bedded dedicated cardiac hospital. Soon we will start this project as government start funding to us. And this is our stroke team. And you see 8 or 10 cardiologists are there. 4 or 6 are not in the picture. Thank you for your patience.